We're here on the red carpet with Carol. Carol,
Hi.
you
Walter.
are the brains, the mastermind, if I might say, of Parkinson's Alliance, or CEO if you
I
like.
got a great team now, Nathan.
An amazing team, an amazing team. Congratulations on 19 years of the Parkinson's Unity Walk. It's amazing to me. 19 years is it's doing so much for the Parkinson's community. I know it's affected me personally, even in my relationship to you.
Met you, yes.
Yeah, in my relation to you. So I know this has got to be an extremely exciting day. Tell me a little bit about this walk specifically and some of the things that you have going on with the Parkinson's community and with the Parkinson's Alliance.
Well, you know, this day, obviously the Parkinson Alliance is the umbrella organization for, number one, the Unity Walk. And it seems kind of crazy to start explaining the Unity Walk because we're here today. But I think because this is going to be on video, there's one thing I really, really want people to understand, and it's always the one message that I ever give to people in any kind of my talks. The challenging news is that we don't have the cause and cure for Parkinson's disease, but the good news is that we have a tremendous number of therapies. But in order to really get the effect of those therapies, you must, absolutely must, be seen by a movement disorder specialist to help you with this disease. That's a general neurologist that has an extra 2 years of training and sees a lot of people with Parkinson's disease. It's amazing, you know, one of the teams that are here today, I helped the team captain find a movement disorder doctor. She'd had Parkinson's for several years. They only changed the timing of her medication. They didn't add any, they didn't delete any. It totally changed her life. It allowed her to sleep. She joined a gym. It allowed her to work out. She lost 10 pounds. Then she got the gym to have a fundraiser and donate all their time and gave money to the Unity Walk.
Perfect.
And that is not a unique example. We get those all the time. So the important thing is that today, because you need a movement disorder specialist and you need all these resources in the education, this is one-stop shopping. You can get it here. So that's the importance of coming to the walk. All the resources that you will need throughout the year to help you understand how to live better with this disease until we find the cause and cure, they're here. So for those who maybe you're not here this year but maybe can come next year, that's the importance of being here.
And I know later on we're going to be talking actually with Dr. Fiona Gupta, who is a movement disorder specialist that is going to be able to help speak exactly to that point.
Yep, absolutely, and she's in our Ask the Doctor booth. And the other thing under the umbrella of the Parkinson Alliance, we have Team Parkinson, and our co-chairs are in Los Angeles, John and Edna Ball. John Ball has had Parkinson's for a little over 40 years and has run 26 marathons. He didn't run a marathon until he got diagnosed with Parkinson's disease. So he is our living proof that exercise slows the progression of the disease. So he will be in our booth, in the Team Parkinson booth today, along with his wife. And the third part under the umbrella of the Parkinson Alliance is the work that we do for the patient community in the area of deep brain stimulation, or DBS. Our president, Margaret Tuckman, had deep brain stimulation in 2000, way before it was FDA approved. And obviously you can imagine in 2000 it was very challenging to find information about this therapy and to find quality information. So after her surgery, she said, I want to make sure that our organization is one place that people can really come throughout the years and find out the best quality information. This is a wonderful therapy if you're the right candidate, but there's a lot that goes into that. So we started a website, dbs4pd.org. Designed the first survey. We had 50 patients with deep brain stimulation in the first survey. We just did our 14th. We now have over 1,000 participants in our surveys. We have over 6,000 responses. We have all 14 surveys and reports that you can download free on the website, and it covers, you know, symptoms like sleep and fatigue and depression and anxiety. We cover both the motor and the non-motor symptoms. We have surveys in our booth that we're handing out today. And in 2009, this is another part of Margaret's vision, we had a DBS consensus conference, and we flew 50 of the world's best neurosurgeons and movement disorder doctors from around the globe. Flew them into New York, and we locked them in a hotel room for 2 days, and we got them to agree on certain issues about this therapy. who's a good candidate, what symptoms does it really help, what symptoms does it not help. And it was facilitated by our good friend Dr. Jeffrey Bronstein, who's the head of the Movement Disorder Center at UCLA. And working with all these people, we got it published in the Archives of Neurology. And that's on the homepage of our website. And I just, before I came here for this interview, met a gentleman whose father had DBS last week, and he went to our website and used that as a resource, because these are the names of people that are doing and have done DBS all over the world for years. So those are the three parts of the organization.
That's great. And actually, on a personal note, I remember when we talked, the DBS was something that was information that really was helpful in me being able to share that with a friend of mine who has been diagnosed that could potentially be a candidate and those kind of things. So
absolutely,
all of this information, all of this research, really making a difference with real people. And that's what we're all here for, is just finding the cure, making a difference, and impacting lives.
Absolutely.
Like impacting lives.
Absolutely. So we talk about, before I left this morning, we looked the ticker, we were almost at 1.4 million. And I always tell people, raising money for research is really important, but it's also about community and education. And for those people, we did a lot of live interviews yesterday, and I said, if you're just hearing about us, just come on out. You don't need to register. You don't need to sign up. At least right now, you can always do that later. But come out and take advantage of the information and education, because information is powerful, and you got to have it, because there's no reason people should not live with a really good quality of life until we find that answer.
All right. And how much of the actual money that's raised is going?
It's 100%. The wonderful lady that founded this, Margot Zobel, that was one of her objectives, that she wanted every single penny to go to research. And because we have wonderful sponsors every year that pay our expenses, we can today, still the 19th year, say that 100% of those go to research. And by the way, if you want to understand all the research, you can go to unitywalk.org, and it's by year, because the organizations, the 7 organizations that receive the money, before they get those checks, they've got to tell us the kind of research they're going to do. And it has to be in lay terms that people can understand. And then they give us 2 years of progress reports. So by year, you can go understand all the portfolio of research that's been done over the years.
That's amazing. So you really know where your money's going, you really know what's happening, and it keeps you up to date on all the information and research for the patients.
Absolutely.
Carol Walton, it is a pleasure.
Thank you.
You're doing great things.
Thank you very much.
I'm proud to call you friend.
Absolutely.
And enjoy the rest of your time here.
Thank you.
Thank you.
Thank you for being here. Thanks, Nathan.
Thank you so much for coming by our tent here to tell a little bit about PAN and what exactly you guys are.
We are an organization in Washington, D.C. that does all the public policy work for the Parkinson's disease community. We're very unique in Washington in that the issues we work on behalf of the whole community, meaning all the national Parkinson's organizations, people with Parkinson's, researchers, neurologists, primary care physicians. We are the only organization on behalf of all the community that works on issues in Congress, issues in the executive branch, funding for Parkinson's disease research, Medicare, Social Security issues. If there's an issue that comes up in Washington that impacts people with Parkinson's, and there are many, we represent the community to make sure the voices of people with Parkinson's are well represented.
That's great. Now, are you involved actually in trying to work on legislation for something?
Yes, we will work with our champions on Capitol Hill. There are a number of members of Congress who, for various either personal or just philosophical reasons, are pretty active on Parkinson's disease issues, and we can work with them either to promote new legislation that would be beneficial to the Parkinson's community, or unfortunately sometimes a piece of legislation is going through that unintentionally or not, would have a negative impact on Parkinson's disease community. Sometimes Medicare issues come up, and we will work pretty hard to make sure we represent the Parkinson's community and bad things don't happen.
Great. It's good to know that there's an advocate in there for the Parkinson's community. Now, why is this all important?
Well, this is very important ultimately because we want better treatments and a cure for Parkinson's. So in that area, we're working on federal funding for Parkinson's disease research. I think people don't always realize how much work the National Institutes of Health, the Department of Defense, interestingly, research that they do on Parkinson's disease, cause, potential prevention, and of course treatments. And so in addition to that, there are many issues, particularly right now in terms of health insurance coverage, whether it's Medicare or private payer, implementation of the Affordable Care Act that was passed, and it's referred to as healthcare reform. All of those issues really impact people with Parkinson's disease. There's a new treatment coming down the road, but your insurance doesn't cover it. It makes it inaccessible for many people, for most people. And so we will work on those kinds of issues.
Are you seeing that there is forward movement in that arena?
This is a really complicated time, both with the shortage of resources as well as all the change coming about because of the Affordable Care Act. So there's certainly, I wouldn't say there's a movement to cut people off from treatments. Nobody wants to do that. But when you have to make cuts, people sometimes propose ideas without realizing the impact it could have on a chronic progressive disease community, for example. And so it's our job to monitor those things and say, hey, wait a minute, bad for us, and then try to work on solutions that work for everybody. And we're often able to do that.
The watchdog.
That's kind of it. We haven't called ourselves that, but I might start.
Now, how is this Unity Walk also really important to that Parkinson's community through your eyes?
Through my eyes, the Unity Walk is a really unique event. It's my 10th, so
wow.
I'm really happy about that. Eventually when we want to stop needing to have the Unity Walk, but for as long as we do, it's a really positive event where the whole community comes together and collectively with a moving activity, literally physically moving, which is nice for a disease that's a movement disorder, physically moving to say, we're going to challenge this, we're going to try and stop this, we're going to raise money, and we're doing it together. We're not doing it as individual separate organizations. And for PAN, which represents the whole community, unity is just such a big part of our existence. And so I just love the walk, and it helps when it's a gorgeous day.
Oh yeah, and you're always stronger together than you are fragmented.
Absolutely.
Amy, thank you so much for coming out.
Pleasure.
And enjoy the walk, the beautiful day in Central Park, and of course, all the booths and everything that the Unity Walk offers.
Thank you.
Thanks
Bye-bye.
again.